Hey guys, welcome back to my channel. It's Jamesia Capri, the nurse practitioner extraordinaire. And if you're new to my channel, welcome, welcome, welcome. If you like, hit that subscribe button and like this video. Tell me what videos you guys want to see on my channel. I am so excited to be back tonight. I am going to be discussing the topic of how do you respond to the pushback from MDs or nurses or even patients when you come in and they expect you to be, I guess, the doctor for the day or whatever, or even the title of doctor. So when I got this question from one of my subscribers, they pretty much said, how do you handle pushback from MDs, nurse practitioners, and nurses specifically with the statement of you're a wannabe doctor? Or, how do you just handle it in general? So I did a little bit of research and I found that, hey guys, thanks for stopping by. I did a little bit of research and I found an article on this specific topic. And let me tell you, we get some pushback. We get pushback from other providers. We get pushback from patients, from nurses, especially in states where we don't have full practice. But I did want to share this article with you guys about nurses getting pushback from MDs. And it's titled, As Nurse Practitioners Push for Expanded Practice Rights, Physicians Push Back. And so pretty much, the American Osteopathic Association put a bill in front of the House, pretty much saying that they wanted to keep the title of doctor, and they didn't want anyone else to use it. Of course, that didn't go through because there's so many other people who use that title. And so really, to answer that question, it really all boils down to fear. And that's not just fear of the actual doctors or nurses that you used to work with. It's fear of patients not understanding who you are and what you can do. And really, it's also your fear. So what we don't want, hey, how you doing, Melissa? It's good to see you. What you don't want to do is you don't want to get into the weeds on this one. So I am going to share with you guys this particular article because I thought it was a really, really good article. I'm not going to read everything verbatim, but I am going to hit some points from the article. So the first thing of this article is that non-clinicians are seeking more practice. And when they say non-clinicians, they're talking about nurse practitioners and physician assistants and pharmacists. So this is pretty much supposed to increase access for our patients so that we can provide care to our patients and to the masses, because physicians alone cannot do it. And it's really supposed to be a good thing for everyone. But for whatever reason, we as nurse practitioners are the ones who get the pushback. It's not the physician assistants. It's not the pharmacist. It's not the dentist. It's not the podiatrist. None of them get any pushback. It's really us as nurses who go on to become nurse practitioners and even further go on to get their doctorate or their PhD. So pretty much the article goes into saying that this particular physician who is really, really fighting pretty much says that nurses are unequally trained, so that's why we should not call ourselves doctors. And even in that statement, I find that the crux of it is really fear. It's fear of them feeling like they're going to lose something that they really didn't even own to begin with, because the title doctor didn't start with physicians. It started with professors. Yeah, that part. But anyway, so pretty much this article says this. It says that under appropriate physician supervision, nurse practitioners provide indispensable care to patients and help redress the worsening physician shortage. Acknowledged by this particular doctor, a physician, but they're very vocal to say that nurse practitioners, they've relentlessly pursued autonomous practice. Well, I don't know what they think we're supposed to do, because if we want to be seen as the professionals that we are, we have to pursue autonomy. That's really the end goal. So when you are pushing for that and it happens, then we are going to step on some people's toes. So when you go into practice as a new nurse practitioner, what I want to say to you is this: you're going to get pushback from physicians. You're going to get pushback from the nurses that you might have worked with on their level. You're going to get pushback from patients. But the main thing that you have to remember is that you went to school for a certain period of time and you have the skill set to do exactly what you're there to do. Now, it will take some time and you will have to gain some respect, which is fine. You will do that in the end. You're going to have to gain respect. And that does take time. It may take 2 years. It may take 4 years. It may take 1 year. You might not know how long it's going to take, but the end goal is that you show that your care is just as quality as any other clinician out there. And in the end, the fear of the doctors you work with, the fear of the patients, all of that fear is going to be calmed because the care that you give is going to be that much quality. So you have to do your part on your end. You have to make sure that you provide good quality care. But I want you to have the information that you need, I guess, statistically. So the American Nurse Association, the American Nurses, the AANP organization has a list of nice bullet points that you can go to and you can pull from. I want you to look at that. And it talks about the amount of nurses that we have in practice. Right now, we have over 290,000 practicing nurse practitioners. And if we were a danger to our patients, we wouldn't continue to grow like we have grown. So keep that in mind. Also, when you get pushback from a physician, I want you to realize that it's not you that they're pushing back against. It's their fear of losing something that they think that they own, which they don't own, but it's their fear. And there's a good possibility that it's your fear also, that you're not good enough or that you're not prepared. But just take comfort in knowing that everyone has to be new at one point in time. So just because you're new today doesn't mean you'll be new next year. So just take joy in that and knowing that all 290,000 of us nurse practitioners that are practicing were once new, and we had to go through it as well. So another thing that I wanted to share with you is that I do believe, let me see what I wrote here, that 28 states have full practice authority, which means that 28 states allow nurse practitioners to practice full practice without collaborating with physicians. So you have that amount of statistical data that backs you in your practice that says, hey, these nurse practitioners have done it. I can do it as well. Now, do you have some nurse practitioners out there practicing that are not up to par? Yeah, you're going to have that. But you also have physicians that are not up to par. You also have podiatrists that are not up to par. There's so many specialties that I can name that are not. But what I'm trying to tell you is this: it does not matter where you go or what you do, you're going to have pushback. So there's no way that you can avoid it. The only thing that you can do is to make sure that you are providing good quality care, and you are educating everyone on what you can do, what you do, and how you do it. But more than anything, more than education, it's going to be your practice and how well you do your practice. That's what's going to speak volumes about your care and about outcomes when it comes to getting pushback from other physicians. So I'll tell you this. I had a situation where I just graduated with my DNP, and I was in a meeting and I was presenting some data on the flu vaccines or something that I was doing. And there was probably 30 people in the room, and there was knowledge that I just graduated probably like 3 or 4 days ago with my DNP. And the chief of staff, and I work at the VA hospital, if you guys did not know, and the chief of staff at the time, the chief of staff is the doctor over all of the doctors in the medical center. And the chief of staff at the time, while I was speaking, someone stopped me and said, Jamesia, what is the number on how many vaccinated nurses do we have on whatever unit? And the chief of staff, who is a medical doctor, stopped the meeting and said, please no longer refer to her as Jamesia. She is Dr. Braxton at that time. So in that moment, I was like, oh, wow. Okay. Wow. He stood in the gap for me in that moment. So there are physicians who will acknowledge you and acknowledge your degree and acknowledge what you bring to the table. And he did not allow anyone to address me other than by Dr. Braxton. And at the time, I was for sure that my nursing colleagues and my friends and everyone would embrace the title, but they didn't. And there were some nurses and friends that I had that vowed that they would never address me as Dr. Braxton Barrett or address me as that, which is hurtful, and it does shock you, but it will happen, and it does happen. However, I have overcome that through the years, and now it's just normal, and it's not because of anything that I've pushed for, but it's because of the care that I show to my patients, to my staff, to people that I work with, my colleagues. And that's how I really feel like the pushback will get addressed. And the fact that my ego doesn't get in the way, because I'm not that I don't care if they don't call me, Dr. Braxton or whatever, but it's not the main goal in what we're doing. The main goal in what we're doing as nurse practitioners is making sure that we're providing quality care. If we continue to provide good quality care, nothing else will keep us from becoming the professional group of people that we need to become, or we need to be recognized as, what I'm saying. So Melissa says, this is amazing. I love how he advocated for you and led by example. Hats off to him. I mean, absolutely. I was blown away by it. I did not expect it, especially from him. He was hard. He was hardcore. And I was not particularly comfortable in the fact that he liked me, but he respected me. So that was incredible that he did that, Melissa. But the thing that I want you to understand is the people that expect may push. But then again, they may stand up for you. And the people that you don't expect to push, maybe the ones that push. I think I might have said that backwards, but you get what I'm trying to say. You think you're going to have this amazing support from one group when you end up getting it from another. But all in all, that's pretty much how that particular story went. And also, I tend to work with a group of individuals who respect all aspects of the team, whether that's um, the respiratory therapist, whether that's the physical therapist. If we bring in that air of respect for everyone, including ourselves, then we absolutely demand it in what we do as professionals. So keep that in mind as a new nurse practitioner, as a new provider. Be prepared and be professional at everything you do. And if you don't know something, don't fake it. Do not fake it. Make sure you pull out your books, pull out your tools, collaborate with someone, ask questions, let the patient know, you know what, I don't know the answer to that, but let me look it up really quickly so you and I can make sure we get this treatment right for you today. There's nothing wrong with that. There's no shame in that because you're new. So be new. It's okay. Everybody had to do it. So another thing that I wanted to talk about, that one of the statistics that you'll find at the aamp.org is that our malpractice rates remain low. They're 1.1%, and we've pretty much kept that there. And we're never really the primary defendants in medical malpractice suits, although we do get some. But our malpractice is way lower than that of physicians. And does that mean we're any better? No, it's just a defense that we're not any worse. So that's that's not gonna fly either. So make sure you get on that website and look at aamp.org at those statistics. So as of right now, like I said earlier, when doctors state that we don't have the practice experience, you have to realize that most of us as nurses, we have nursing experience. And when they first come into practice, they don't have any. Again, I'm not comparing, saying that we're any better. I'm just saying that we're 100% not any worse. We're just different. And I think that's what makes it very uncomfortable for our physician counselors because they look at us as a threat to their, when we're not a threat to their practice, we are an asset to any practice. Now, if they continue to look at us as a threat, then maybe in their mind, that's what we'll be. And again, that goes to the ego. And I wanted to say to all of you out there that please leave your ego at the door when you start practice, because if someone comes to you and say you're a wannabe doctor, or you're a wannabe physician, or you're a wannabe anything, then that's okay. Then maybe they have an issue that they need to deal with. That is not your issue, as long as you continue to provide quality care. But if you continue to get the pushback, be sure to give them some statistics on what we do and how long we've been in practice and all of the things that I talked about earlier in this video. Because again, there are 290,000 practicing nurse practitioners, and I'm sure that has increased. That was 2019 statistics, but I did want to share that with you. Also, another thing that I wanted to mention, we as nurse practitioners, we get pushback from patients wanting to call us doctors when we might not necessarily have our doctorate. Some of us do, some of us don't. And in that moment, you may feel comfortable to say, I'm not a doctor, I am a provider, which is the absolute right thing to say. Let them know that you're not a doctor, that you are a provider, and you'll be providing their care for the day, and that you're a nurse practitioner, and whatever else you would like to say from that point. But don't misrepresent yourself. But if you do hold a doctorate or a PhD, then I suggest that if in your state you can say, because some states do not allow you to say that you're a doctor if you have a PhD or a doctorate. Which states those are, I cannot be 100%, but I know there are some states that don't allow that. However, the state I'm in does, so I do use my title because I have a doctorate. Anyone who has a PhD or a doctorate or an MD or a DO is allowed to call themselves a doctor. I believe that natural medicine also can do that as well. So sometimes you have to educate your patient, but that's okay. If you get a patient who says they don't want to be seen by you, then you politely let the management know and you move on to the next patient that does want to be seen by you, because trust me, we stay busy. There are so many people who need to be seen by us. So I guess take solace in knowing that some patients will not want to be seen by a nurse practitioner because they feel like they prefer to be seen by a medical doctor, which is totally fine. Now, a lot of practices like the CVS, Minute Clinic, Walgreens, wherever, Walmart, Rite Aid, all of the clinics like that are only ran by nurse practitioners. I don't know if you guys knew that, but those are nurse practitioner ran clinics. And so patients go to those clinics and they don't even realize they're being seen by a nurse practitioner or a physician assistant. Now, I don't want to misspeak, but I don't believe physician assistants are working in those clinics, but I do know they're mostly nurse practitioner ran. But that's your opportunity to educate your patient on what you do and who you are and what your basis is as your practice, which is being a nurse first and then going forward, getting your nurse practitioner. So that's another opportunity as well. And I believe that the reason why we get pushback is because, guys, we have just blown up. We're everywhere. We're just taking this thing global. We're just everywhere. And that's great. So I suspect that we will get some pushback from some physicians at some point in time. But yeah, guys, I hope that gives you a little bit of help or gives you a little bit of tools to use. Let me see, did I go over everything that I wanted to go over with you guys tonight? I do believe that is it. I wanted to close this session with just this one thing. And Melissa, please let me know if you have a question before I leave for tonight. But I did want to close with this one thing about this question that I got. And again, the question was, let me read it because I want to make sure that I get it correctly for the person who asked me to do this video. The question was, how do you handle the pushback from MDs, nurse practitioners, nurses, and patients, specifically the statement, "You're a wannabe doctor"? So my answer to that is, once you conquer that fear of being new and not knowing everything, then I do believe that question will get a little bit easier to answer. And you will get comfortable in your own skin of being who you are, because you may not be a physician, but you are a provider and you are a healer and you are there to help our patients, and you do increase access to care. So that's what it is. And it is going to be hard for some people to swallow that pill, but that's just what it is. And I think you guys will benefit from this video. I thank you again, Melissa, for sticking around. And thank you so much for saying that was informative. But just know that there are 290,000 nurse practitioners who will have sat in the same seat that you have to sit in very soon as a new practicing nurse practitioner. But it does get easier, and it is a great profession, and I'm so happy that you chose it. And if you have any questions that you want to ask me, leave them in the comments below. Please like this video because it does help get my videos out there to all of you who need it. Subscribe to my channel if you haven't already. And I thank you so much, extraordinary people, for stopping by. And I will see you in the next video. On next Thursday, I'm going to do another live. I forgot to say what that's about. I'll put it in the description. I cannot remember what I'm going to do that on. But yeah. So yeah, guys, thanks a lot for stopping by. Take care. Bye, guys.